to Disease-Free Society, where we decode health without noise. Every week, we uncover one hidden truth about better health. Today is a special day. We are celebrating women. It is rightly said that hands that cradle can rock the world. In today's episode, we not only celebrate women, we celebrate the force of nature that refuse to be ignored. We talk about women health, but in a different way. Women walk in clinic carrying different labels. Thyroid, PCOS, perimenopause, menopause, hair fall, acne, you name it, and woman is given that label. We are today understanding that. To clear the confusion, I am joined by Dr. Virender Sodhi and Dr. Anju Sodhi. Dr. Anju Sodhi, along with Dr. Virender Sodhi, is an Ayurvedic practitioner at Ayush Ayurvedic and Naturopathic Sciences. She extensively worked with women, thyroid, PCOS, and other stress-related hormonal changes that women go through. The thing that I like about Dr. Anju is that she doesn't treat labels. She understands the pattern, digestion, inflammation, rhythmic pattern that body is going through, not the label that woman is defined. Dr. Anju, many patients walk in your clinic with all these labels. Is it the reality or?
That is not the reality, Swati. We see the patients. I deal with all the patients, but especially the women. And I see from all ages, from menarche to menopause. And there is so much going on these days. We celebrate women every day. We don't empower in one day. Women can be a mother, women can be a wife, women is a sister, women is a daughter. So women plays many role in her life, and she goes through a lot too. In my practice, I see the patients coming as a families coming. I see the mother and then I see the daughters too. So there is so much stress going on.
So you know the pattern, you identify the pattern, what mother has gone through, what daughter might go through. You recognize that pattern.
So there is so much going on. First of all, it's diet.
The lifestyle you are talking about.
Lifestyle. So if the mother lifestyle is good, many times the daughter's lifestyle is good too. But if mother's lifestyle is not good, it's impacting the whole family.
Dr. Sodhi, do you agree with Dr. Anju?
Yes, I think 100%. So, like for example, I will give you an example. I love exercise. I used to force my wife to exercise, and we fought almost 10 years on it. And she will not go to the club. Although I have membership, will never join. Then I used to say, okay, I'm going, darling, you want to join me? And then somehow it clicked and she started going to the
word join rather than do it.
And forcing will create a bigger feud. And then what happened is my son also started exercising. And when he got married to his wife, the first thing he did, he bought the membership for his wife. I'm so proud of them. Trainer come to their homes twice a week and they train them. I said, oh my God, I felt so good because I, as a father, I was able to put those nuggets in their head.
The perfect example, rather you want to say that is, children copy their parents. Whatever they do.
Yes. For example, if I'm seeing a 8 to 10 years old girl and then she's coming with the mother, I have to ask how the mother is, what you are eating. Many times the history we take is extensive because we want to know what is happening at their home too. So how is the stress level in the life?
The pattern that you recognize.
Pattern, yes.
Okay.
So then the family history, like if there is any history of the thyroid issue, which is a big one in today's society.
Coming to this one, thyroid, it's a big taboo there. So why do we see so much increase in the cases of thyroid nowadays, and how complicated is it?
There is so much going on with the hormones these days, and I really think that generation is digitalized. They are glued to the TV or the tablets or parents do not stop that. And I think that is causing the issue. And again, then eating is not the right way. So there is a lot of factors we need to see into today's
So
world.
it's the lifestyle. What I'm hearing is it's not women who are not fixed. It's the lifestyle. They are just overloaded with the thing. That is what you wanna say to the audience.
Yeah, Swati, the thing is, like, if you look at it in our today's food, you come from the same state which I'm born and raised, and you born and raised the same. Himachal used to be so clean. There was no chemicals. There was no fertilizers. It was all organic, and we didn't know there was organic.
Yeah.
That there was no term for that because this was the natural. So now you look at this so much heavy load of chemicals in these things, and then on top of everything has the plastics in it, and they are disruptors. They disrupt the thyroid hormone. And then we eating food which is like very much deficient in minerals, and one of them is iodine. I know that's why we people say take iodine salt, but iodine salt does not fix everything either. You can be low in iron, your ferritin levels, and majority of the doctor don't even test ferritin level. If your ferritin levels are low, your thyroid is never going to be functioning. And it's surprisingly, I have seen so many kids lately who has enlarged thyroid, and they have been going to their pediatrician, nobody even palpated the thyroid. And when I said, okay, need to get ultrasound done, the ultrasound, the radiology department refused to do the ultrasound. They said they have to be taken to the children's hospital. So it's kind of very, very sad that how things has been, we have created a barriers rather than helping that kid there.
So if Swati is, as you mentioned, if the thyroid is not balanced, then sometimes parents do not take the children to the physician, and for many years it's not been diagnosed that kid can have a hypothyroid. So if they have the hypothyroid and if they don't go to the doctor, it's going to affect all the other hormones, and especially the female hormones too, and then they are dealing with the other issues.
The other issue recalls me, the another trending thing that is with the women is PCOS. We hear it everywhere, and there are many rise in the cases of PCOS. I'm sure you might be seeing all the women with PCOS in your clinic.
Definitely.
So why is it that there is so much rise in these cases?
So I think the major is the digitalized.
Okay.
They are so much in front of the at the schools too. There's so much radiation. It's affecting their hormones.
The women are sitting because they are stressed. So you want to say that the woman is stressed. She's doing the job, playing all the other roles, and then these and not taking care of the food. So that is what just disturbs the thing.
That is very much correct.
Yeah, so the lack of the movement, and then on top of all the chemical load, you're gonna have PCOS because this is gonna disturb your hormone.
Let's talk about the root cause. So these days I am seeing girls are having the periods at very early age. They are starting at 8 or 9 year old
Yeah.
sometimes.
That's way too early.
That's way too early.
Yeah.
And then the periods are very difficult and painful, and then they are having a lot of, and the 8 and 9 year old girl is just a kid.
They don't
They
know
do
how
not
to take
understand, and then due to the stress, their eating habits worsens. They are eating, and the parents are not aware, and so they don't know how to stop the children. So that affects their hormones, start affecting at that age. And then after some time, like I have seen that they are having the periods, and then there is no periods for maybe 2 years or so. If they are not paying attention, then it will be changing into the other hormonal issues, irregular periods.
Because at 13 that age triggers for the
Yes,
hormone.
yes. So girls are having the irregular periods because they start the period early, and then they don't know the cause, and then like that changes into many times it changes into the PCOS because of the, as I mentioned, tablets or the TV or the media.
There is no natural care to the kid, is
No.
what, as you say, we
Yeah.
need to go back to the roots.
Yeah, exercise.
Exercise.
And they are
No
not
way.
exercising
Yeah.
because they are glued, and that
I think these cell phones are another disease
cell phone
too.
is the other disease.
Social media
Yes.
is another problem.
So make sure they are eating well, they are moving around, they are exercising, they are playing outside, and most of it, they are sleeping well at night.
Yeah.
So what I get is, it is not fear that cures the PCOS, it is the rhythm that cures PCOS. We need our bodies to be in the rhythm circadian rhythm rather, sir. Am
That's
I right?
Your biorhythms matches with the circadian rhythm. So your circadian rhythm is the natural rhythm of the universe, and you have a biorhythm. Actually, so funny. We are so connected. When we are connected with this circadian rhythm and biorhythm, body does not want to be sick then. And most of us
we can cure all
yeah,
these
exactly,
things.
exactly.
By the time they are in their teen, they are already having a lot of issues. They have started having the acne, overweight, and then like they don't know how to deal with it, and the parents do not know how to deal with it. So my suggestion would be start paying attention when they are in the early stage of the preteens. So stress keeps on going high and high as now they are in the higher classes. There is a education load, and then on the top they are dealing with the acne, they are dealing with the overweight, and it's giving them all the stress. So that will affect their hormones even more, and they start having amenorrhea, which is the absence of the period. And then at that time the parents pay more attention to, and the girl pay more attention to, and then they seek the help of a healthcare practitioner.
So now the basis for the stress is set for that poor girl who is just in her teens. When she comes to your clinic, maybe in her teens or in her late 30s or 20s, how you guys treat that person?
I think, one of the very important thing is just look at their kitchen. There is all those packaged food. That is the best garbage. Even I don't care if it's a health food store garbage. It's a garbage. Because you're not going to get health. It has a bad oils, the fried in that oils, and it's the shelf life. If your food is not fresh, you're not going to get a real nutrition. So Twinkies, look at the Jell-O bags they're eating, the amount of chocolate or the sugar they're eating. So now you think that is going to help. That's the reason, one of the reasons why they're gaining weight. So we need to look at, so I think Dr. Anju said it very well. If the mom is not paying attention or the dad is not paying attention, your kid is not going to be happy. It's rather a girl or boy, doesn't matter.
So when I see the patients at my clinic, I start with the lab work. It's very important to see. I always tell them it's important to start some basic blood work and check the thyroid and see if the child is not anemic or the girl is not anemic. So that gives us if we are not missing anything.
We start the baseline.
Start the
Yeah.
baseline. So if there is a thyroid issue, we want to address that. So that will help with their hormone levels otherwise too. And also then pay attention to the food. So we talk about the food, and sometimes it's very important then if parents say something and the doctor say something, they will listen to the doctor and not to the parents. But same time, we have to educate the parents too that how to deal with this. Because at this time, the kids are very emotional too.
So if I say, what is the role of the mother here for that kid who is in so much of stress? What would be, as a mother, as a female there?
I feel that because today's society, every mother is working too. So they do not have enough time to take care of the kid. I will make that girl responsible for paying attention to the eating habits rather than focusing on the mother. So, okay, you eating this, and we need to cut down the sugar, which is the biggest thing, and we need to cut down the carbs because they are overweight. Most of the PCOS patients are overweight. And then also adding the exercise. And then on top of that, then I recommend some herbs to help them. And most of them is emotionally helped. They need emotional help.
They need the support from their parent that
Exactly.
meets them.
From the parents, need to talk to them in a way they don't feel overwhelmed. Sometimes at the age I see the girls, like when they are in their 16, 17, hormones are changing and they are overwhelmed.
Yeah.
So parents has to be very supportive at that time. And so with the help of the practitioner and the parents, I think we will get the results.
The guided path is what that you make
That's
them
right.
walk
Yes.
on.
Yeah.
And same time, we need to pay attention if they are dealing with some thyroid issue or anemia. So we address that correctly too.
And anemia can be, not only iron, can be B12 deficient, especially in the vegetarian population. And majority of our patients which we see are vegetarian because we see cater to a lot of Indian population. the majority of them are vegetarian, and they almost everybody is low in. Even people who are eating meat, they are still low in B12 because it's a digestive issue. If you're taking a proton pump inhibitor like a antacid, your body is not making enough acid, and you're going to not absorb your B12. So you have to look at the whole picture, and then guide the female. And these, if your female doesn't have energy, B12 gives you energy. If the female is low in iron, she will have no energy. Now, she's lacking behind, the whole house fell apart.
And then again, stress pitches
Stress,
in,
yeah.
and the same
Stress.
cycle repeats
Yes.
and repeats.
It's a domino effect. One thing falls down and everything goes down with it.
Let's talk about the menopause. I mean, there might be children we talked about. There are other teens that come to the clinic. Then there were the women who come to your clinic. Now menopause.
So menopause is not a disease. It's a physiological phenomena where we end the periods. With the menarche, the period starts, and menopause, it ends. It's so interesting that I am seeing women patients from their 38, 39. They come to me and they give a label. They are premenopausal.
The buzzword I was about to come there. The
Yeah.
premenopause thing.
Yes.
Yeah.
And which is true. They are having all the menopausal or premenopausal symptoms. They are having the night sweats. They are having the hot flashes. They're like the painful periods, and the periods are like irregular, like it's coming every 6 weeks to 12 weeks. And so there is so many things they are dealing with it. And that is true. The hormone starts declining after 38, but that doesn't mean they should be having a premenopausal symptoms. So again, there is some irregularity in the hormones, and we need to pay attention to that.
So they are not understanding the pattern behind it. They are just labeling it.
Labeling it the premenopause, and then we need to see as Ayurveda doesn't treat all these are the symptoms, and Ayurveda treats the whole person.
Mhm.
So there is so many things can be done, and again, like start with something. Counseling is very important. Counsel them that okay, you don't want your ovaries to shut down at this age. Let's start with some herbs and supplements. Let's look at your lifestyle. Let's look at how you are eating.
Taking care of the body.
Taking care of the body, and that helps. And if they follow, we get the results.
Okay.
But many times they are not good follower. So
They're looking for a pill. They're looking for something magic.
again, sometimes they come with the multiple things, and then they say that they don't want to take the they don't hate to take the supplements.
We have now Dr. Instagram and Dr. Google. I see one woman taking at least 8 to 10 supplements for good health, biotin, nails, hair, whatnot, collagen. Is it the right thing? I mean,
It depends
okay.
if they are doing the right thing
Mm.
or not. Sometimes they are not paying attention to the gut.
Okay.
If their gut is their microbiomes are not good and having issues with the gut, they are not absorbing it. So it's all goes in the waste. So it's important to talk about it. Talk with your practitioner and see if you are having some issues with the. Many times these days we see patients with the irritable bowel syndrome, and so absorption is an issue. So they are not paying attention to the gut, but they are taking multiple supplements for the multiple reasons.
Because
And-
it's like out there.
Yeah.
They have
Yeah,
to
they
take it.
they are maybe overloading the system because
Yeah.
the body has a particular guidelines. It does not want too much. Eat wild caught fish. Wild meat is more better than domesticated because they are eating what is available in the mother nature, and we are eating what we produce, and then on top of it we put lot of supplements on top of it. So may not be the best thing for us.
So, Dr. Anju, you don't prescribe supplements, the buzz thing. You just see the patient, understand it, and then depending upon what's
Depending on
deficient.
what they need, we work through the gut. It's very important. We if their gut is not behaving, inflammation. Though if they are not digesting the food, they will not be absorbing the good nutrients, and then they have the inflammation. So we need to work on the inflammation first and the gut first. So that's what we do at our clinic, and then accordingly we prescribe the supplements what they need.
So, women are not overloaded. They are not
supported properly is what I want to say here.
That is correct.
Yeah.
And they have to take command on their hand, because if they will not pay attention to their health, then who will pay attention?
What advice would we want to give to the women listeners here?
We women are the givers. We need to own our body. We can be selfish. Take care of yourself. Go for walk. Do exercise. And then if there is need to take some supplements, take with your guidance of your healthcare practitioner, or take the right one. Do not take anything which Dr. Google or Dr. Instagram will tell you.
Although the women are the center of the universe, but they're also very stressed out. The society demands too much from a girl. They are the mother, they are the sister, they are the wife, and they expect more than that. So basically, I think as Dr. Anju said, they need to be selfish, and me first. When you take care of yourself first, then you will be surprised that everything else falls in its place automatically.
I would like to add one more thing. Like I said, women can be selfish. Many times I see my women patient, they are not taking care of themselves. They have some issues going on in their body and they are ignoring it for many years because they are scared of going to the healthcare practitioner. If they're having some issues, they know that they are having, for example, some nod or lump into the breast, but they are scared of going to the doctor and getting help.
Checked out.
Seek help. Live in harmony. Involve everybody in your household. Talk to your children. Talk to your husband, and stay well.
If you are a woman listening to us and this conversation resonated with you, you are not alone. You are not broken. You are just overloaded. Leave the comment in the comment section and tell us what else you need to discuss. Share us your concerns and like, share and subscribe. Thank you.